Your nights reveal more about your health than you might realize. While you sleep, your body whispers its secrets. For millions with undiagnosed diabetes, these nighttime signals are the earliest warning system your body has. These silent alarms often appear years before a formal diagnosis, giving you precious time to intervene. Tonight, we're uncovering 15 nighttime signals that diabetes might be developing in your body, even if you feel completely fine during the day. The most alarming part: medical research shows these symptoms typically emerge 3 to 5 years before blood tests detect the condition. Let's get into the warning signs your body sends after dark. When you have diabetes, your body struggles with insulin, the hormone responsible for moving glucose from your bloodstream into your cells. This creates a nightly battleground where your body fights to maintain balance. During sleep, your metabolism shifts and hormone levels fluctuate naturally. For someone developing diabetes, these normal changes become amplified, turning subtle processes into noticeable symptoms. Your nervous system, kidneys, and brain all respond to these glucose disturbances, creating distinctive signals that emerge primarily at night. Let's uncover the first major warning sign your body sends. If you're constantly getting up to use the bathroom at night, your kidneys might be sending you an urgent message. When blood glucose levels rise, your kidneys work overtime to filter excess sugar. This creates more urine production, a condition doctors call nocturia. Research from Harvard Medical School shows that nocturia affects over 65% of undiagnosed diabetics, appearing before any other symptoms. Your kidneys essentially force you to urinate more frequently to eliminate glucose, disrupting your sleep cycle and leading to fatigue. This isn't just annoying, it's your body's early warning system. To determine if your nighttime bathroom trips are concerning, track how often you wake up to urinate. More than twice per night consistently warrants attention, especially if this is a new pattern. This symptom alone can appear up to 4 years before diabetes is diagnosed. And here's what makes this worse: that overwhelming thirst hitting you at 2 a.m. isn't random. When your body loses fluid through excessive urination, your brain receives dehydration signals, triggering intense thirst. This creates a dangerous cycle. The more you drink, the more you urinate, further depleting vital electrolytes. What makes nighttime thirst particularly concerning is its intensity. You might find yourself draining multiple glasses of water yet feeling unsatisfied. This happens because high blood glucose creates osmotic pressure, pulling water from your tissues. Recent studies show this symptom appears in nearly 75% of pre-diabetic patients, making it one of the earliest detectable signs. To differentiate normal thirst from diabetes-related thirst, notice if water temporarily satisfies you or if the craving returns almost immediately. This persistent cycle deserves medical attention. But before you reach for that glass of water, consider if you've been experiencing another strange symptom. Waking up drenched in sweat when your room isn't hot signals something significant happening inside your body. Night sweats in diabetes often indicate rapid blood sugar drops during sleep. When glucose plummets, your body releases adrenaline to raise blood sugar levels. This emergency response increases heart rate and activates sweat glands, leaving you soaked and confused. A 2023 study in the Journal of Sleep Medicine found that 61% of newly diagnosed diabetics reported experiencing night sweats in the months before diagnosis. The distinct feature of diabetes-related night sweats is their intensity. Bedding and sleepwear become noticeably wet, often requiring changes in the middle of the night. To determine if your night sweats might be diabetes-related, note whether they occur alongside hunger or heart palpitations, which suggests low blood sugar episodes. But night sweats aren't the only thing keeping diabetics awake. That frustrating inability to fall or stay asleep might be more than stress or aging. Blood sugar instability creates a perfect storm for insomnia. When glucose levels fluctuate dramatically at night, your body releases stress hormones like cortisol and adrenaline. These hormones keep you alert and prevent deep sleep, leaving you exhausted yet unable to rest. What's concerning is the vicious cycle this creates. Sleep deprivation itself increases insulin resistance, making glucose regulation even more difficult. Research from the American Diabetes Association shows that people with prediabetes experience 23% more sleep disruptions than those with normal glucose levels. If you find yourself simultaneously exhausted yet unable to sleep, Especially if you wake between 2 to 4 a.m. regularly, your blood sugar regulation deserves investigation. The timing matters because this corresponds with the body's natural cortisol fluctuations, which become exaggerated with diabetes. But sometimes the problem isn't falling asleep, it's what happens while you're sleeping. Those gasping moments in the night aren't just snoring. They might be sleep apnea, which has a surprising connection to diabetes. Sleep apnea occurs when breathing repeatedly stops during sleep, sometimes hundreds of times nightly. Recent research reveals a bidirectional relationship. Diabetes increases sleep apnea risk by 48%, while sleep apnea raises diabetes risk by 40%. This dangerous relationship stems from how interrupted breathing affects blood sugar. Each time breathing stops, oxygen levels drop and stress hormones surge, elevating blood glucose. The distinctive feature of diabetes-related sleep apnea is its early onset, often appearing before obesity, traditionally considered the primary risk factor. If your partner notices pauses in your breathing during sleep, or you wake with a dry mouth and morning headaches despite sleeping all night, this requires medical attention. These first 5 symptoms represent early warning signs, but they're just the beginning. Let me tell you about what happens when the condition progresses. That irresistible urge to move your legs at night isn't just annoying, it might be your nerves responding to glucose damage. Restless leg syndrome, RLS, creates uncomfortable sensations that are only relieved by movement, making sleep nearly impossible. Research published in the Journal of Clinical Sleep Medicine found that people with diabetes are 4 times more likely to experience RLS than non-diabetics. This happens because elevated glucose damages peripheral nerves, creating abnormal sensations particularly noticeable during rest. The unique feature of diabetes-related RLS is its rapid progression. Symptoms worsen more quickly than idiopathic RLS. If you experience these uncomfortable sensations primarily at night, especially with pins and needles or burning feelings, your doctor should check your blood glucose. But restless legs aren't the only nighttime pain diabetes can cause. Those excruciating leg cramps jolting you awake aren't random muscle spasms. When diabetes damages peripheral nerves, a condition called neuropathy, they send incorrect signals to muscles, causing sudden, intense contractions. Additionally, diabetes affects electrolyte balance and circulation, further contributing to painful nighttime cramping. According to research from Johns Hopkins, nearly 50% of people with early diabetes experience nighttime leg cramps before other symptoms appear. The distinctive feature of diabetes-related leg cramps is their timing and location. They typically strike between 2 to 4 a.m. and concentrate in the calves rather than throughout the body. If you're experiencing regular nighttime leg cramps, especially paired with tingling or burning sensations, this warrants blood glucose testing. But while some symptoms cause pain, others create stranger sensations. That strange tingling or numbness in your feet and legs at night might be peripheral neuropathy, one of diabetes' most common complications. High blood glucose damages nerves over time, creating sensations ranging from mild tingling to complete numbness. What's particularly concerning is how these symptoms intensify at night. When you're lying still and environmental distractions diminish, nerve damage becomes more noticeable. Research from the American Academy of Neurology shows that nearly 13% of pre-diabetics already have detectable neuropathy years before meeting diagnostic criteria for diabetes. The distinctive feature of diabetes-related neuropathy is its symmetrical pattern. It typically affects both feet or legs equally. If you experience pins and needles, burning sensations, or numbness primarily at night, especially if it's getting worse over time, seek evaluation. But nerve damage isn't the only way diabetes disrupts your sleep. Those nights when you wake suddenly feeling panicked, shaky, and sweating profusely might be low blood sugar episodes. Nighttime hypoglycemia occurs when blood glucose drops below normal levels during sleep. This triggers an emergency response from your body, releasing adrenaline and causing alarming symptoms. Research shows that people with early insulin resistance often experience reactive hypoglycemia, where blood sugar drops too low after initially being too high. This can happen even before you're diagnosed with diabetes. The distinctive feature of nighttime hypoglycemia is its dramatic presentation. You may wake suddenly feeling like something is terribly wrong. Heart racing, confusion, trembling, and intense hunger commonly accompany these episodes. If you experience these dramatic nighttime awakenings, especially if eating something sweet provides immediate relief, speak with your doctor. This symptom requires immediate attention as severe hypoglycemia can be dangerous. But sometimes, the danger manifests in more subtle ways. Those disturbing, intense dreams that jolt you awake aren't just random brain activity. Blood sugar fluctuations directly affect brain chemistry and function during REM sleep. When glucose levels rise or fall dramatically, the brain experiences stress that manifests as vivid, often frightening dreams. Recent neurological research reveals that people with uncontrolled blood sugar experience 37% more nightmares than those with stable glucose levels. What makes diabetes-related nightmares unique is their recurring themes of danger, helplessness, or being pursued, reflecting your body's physiological stress. If you're experiencing an increase in disturbing dreams, especially alongside other symptoms mentioned, this cognitive disturbance deserves attention. This marks our halfway point through these warning signs. Let me tell you about the more advanced symptoms that emerge as the condition progresses. That burning sensation rising from your stomach to your throat at night might be connected to diabetes. When diabetes damages the vagus nerve, it affects digestive function, including the esophageal sphincter that normally prevents stomach acid from flowing upward. This neurological damage, called autonomic neuropathy, often appears before diabetes diagnosis. Research published in the World Journal of Gastroenterology found that people with diabetes are 61% more likely to experience nighttime acid reflux than the general population. The distinctive feature of diabetes-related reflux is its resistance to typical treatments and its prevalence specifically during sleeping hours. If you're experiencing persistent nighttime reflux despite lifestyle changes, particularly if it's accompanied by slower digestion, consider glucose testing. But while reflux keeps some diabetics awake, others face a different battle. That morning jaw pain and dental wear might stem from nighttime teeth grinding connected to diabetes. Bruxism, teeth grinding, increases significantly in people with unstable blood sugar. When glucose fluctuates during sleep, stress hormones like cortisol increase, creating muscle tension particularly in the jaw area. Additionally, neuropathy can affect cranial nerves, altering muscle control around the mouth. Studies show people with diabetes are 1.4 times more likely to experience bruxism than those with normal glucose levels. The defining characteristic of diabetes-related teeth grinding is its association with other autonomic symptoms like variable heart rate or digestive issues. If your dentist notices teeth grinding damage and you're experiencing other symptoms on this list, mention both to your doctor. This connection is often overlooked but can provide early diagnostic clues. But grinding teeth isn't the only pressure diabetes creates. That elevated blood pressure reading at night reveals something crucial about your cardiovascular health. Normally, blood pressure decreases by 10 to 20% during sleep, a phenomenon called dipping. Research shows that people with diabetes often lack this dipping pattern, instead maintaining or even increasing blood pressure at night. This non-dipping pattern appears years before diabetes diagnosis and significantly increases stroke and heart attack risk. A large-scale study by the American Heart Association found that 61% of pre-diabetics already show non-dipping blood pressure patterns. The distinctive feature is the reversal of normal circadian blood pressure patterns. Readings stay high when they should naturally decrease. If home monitoring shows your blood pressure remains elevated at night, this abnormal pattern warrants medical investigation. This disruption of normal rhythms extends beyond blood pressure. Those moments when your heart seems to pound, skip beats, or race while resting might signal glucose-related cardiovascular stress. Heart palpitations occur when blood sugar fluctuations trigger the release of stress hormones that affect cardiac rhythm. Additionally, insulin resistance directly impacts heart muscle function and electrolyte balance. Research published in the European Heart Journal found that arrhythmias are 2.5 times more common in people with prediabetes compared to those with normal glucose metabolism. The distinguishing feature of diabetes-related palpitations is their occurrence during rest rather than exertion, particularly common between 2 to 4 a.m. If you experience recurring heart rhythm disturbances at night, especially if accompanied by other symptoms on this list, cardiovascular and diabetes evaluation is essential. But heart issues aren't the only serious complication that emerges at night. That throbbing pain greeting you each morning isn't just from poor sleep. Morning headaches and diabetes stem from multiple factors including nocturnal hypoglycemia, sleep apnea, and dehydration from excessive urination. Overnight glucose fluctuations cause blood vessel changes in the brain, triggering pain upon waking. Research from the American Headache Society found that people with undiagnosed diabetes are 40% more likely to experience chronic morning headaches. The distinctive feature of diabetes-related morning headaches is their consistent timing and resistance to typical headache remedies. If you wake with headaches regularly, especially alongside fatigue despite sufficient sleep hours, this pattern deserves medical investigation. This symptom often indicates advanced glucose dysregulation requiring prompt attention. Now that you understand these 15 nighttime warning signs, here's what you need to know about taking action. If you're experiencing 3 or more of these symptoms, your risk of having undiagnosed diabetes increases dramatically. Recent research shows that symptom clusters are more predictive than individual symptoms. Even if your last blood test was normal, these nighttime signs might be catching diabetes in its earliest stages, before laboratory tests detect it. The most effective first step is documenting your symptoms in detail, which ones you experience, their frequency, and intensity. This information helps healthcare providers connect patterns that might otherwise be missed. Beyond testing, lifestyle interventions can often reverse early diabetes progression. Studies show that moderate weight loss, 5 to 7% of body weight, and regular physical activity can reduce diabetes risk by up to 58%. Timing your meals, particularly avoiding late dinners, significantly impacts overnight glucose control. Research demonstrates that finishing eating 3 hours before bedtime improves morning glucose readings by approximately 20%. Sleep quality itself becomes a critical intervention. Addressing sleep issues not only improves symptoms, but directly impacts glucose regulation. It's your turn to act. You've now discovered 15 silent nighttime signals that diabetes might be developing in your body. Knowledge is power, but only when applied. Let me know in the comments which of these symptoms you've experienced, or if you have questions about managing them. If you found this information valuable, like this video and subscribe to our channel for more evidence-based health content that could literally save your life. The video appearing on your screen might be the one you need to see. Click now to continue your health journey. Remember, what happens during the night reveals the truth about your health. Don't ignore these signals, they might be your body's most urgent message.